So the natural history study is really an attempt to try to define what is the variability in the way these patients present. If we look at all the cases that have been reported, we have small case reports, normally 2 or 3 patients, a one-time picture of what's happening with them. But really for a natural history study, we want to follow along and document as many cases as we can in both a prospective and retrospective manner. So we've gone across the world to try to find patients who've treated Farber disease and try to include as many patients as we can. The main goal of this is actually to try to look at the diversity of how these patients present, but also what is the progression of this disease. And we can do that by doing specific measurements, for example, clinical measurements or biochemical measurements as we go forward. So it really gives us some good prospective data that we can follow through with. And if we know the natural history, and then we have an intervention that we can use as a treatment, we can then look at how these cases are doing compared to what we know about the natural history. So that's really the goal of a natural history study. So one of the things that we haven't got data yet, but we're looking at the biochemical parameters, the markers, so to speak, that we would see in the blood. And I think this is going to be the largest group of patients where we'll be able to try to see what are the chemicals that are causing the problem. When I speak about ceramides, we think about one chemical, but ceramides are actually a very complex a family of chemicals. And we know that some of them are high in Farber patients and others are low. So if we understand how those chemicals are measured and what's their variability in these patients, we may be able to specifically target those chemicals for treatment as well. I think the other thing that's important is when we look at these patients, we confirm that the variability is there. So some patients are presenting very early and die very rapidly, but there's other patients that have fairly mild presentation and have been followed, for example, in a rheumatology clinic with a diagnosis of Farber that wasn't known for many years. So there are milder patients out there, and this study sort of helped confirm that as well.